Tom LeBlanc developed terminal cancer after fighting wildfires for 35 years.
This one's 2017.
His wife, Kim, was locked in a battle for compensation for nearly a decade.
That's Tom sitting there.
Last fall, she had this message for the Ford government.
Stand up, put your big boy pants on, and let's see how we fix this.
Now, Ontario is proposing new legislation
to ensure wildland firefighters and investigators have the same presumptive coverage that municipal firefighters have.
If passed, Ontario's wildfire fighters would get the same coverage for cancer, heart disease, and PTSD as other firefighters.
Holy shit, took them long enough.
For LeBlanc, this is closure and a sign of respect for wildfire fighters and their families.
Now it'll be an automatic. They won't have to waste all that time and money and heartache and, wait for WSIB to respond.
Only 5 other provinces offer wildfire fighters the same blanket coverage as structural firefighters.
I think it's long overdue, and I think now if other provinces are paying attention that they need to expand it to each and every province in Canada too.
But the National Union of Public and General Employees wants the federal government to give wildfire fighters the same national classification as other firefighters, which would net them a better pension rate.
Unfortunately, they're excluded as firefighters for those benefits and not recognized as firefighters at all, and we think that's a tragedy.
Kim LeBlanc says wildfire fighters across the country need to be treated the same.
It should be an level playing field. They should all be treated with respect and concern, and given if you want us to do the job, then you best be looking after us.
After all, demands on wildfire fighters are expected to soar this summer, and so inevitably will the risks they face.
So, Katie, this is a big deal. Can we walk through what it means for the retired wildfire fighters?
Yeah, so the province is actually baking in retroactivity to this proposed legislation. So wildfire fighters who develop the associated cancers or heart disease should be able to make claims dating back to 1960. Now, when we first started looking into this last year, we tried to find some of Tom LeBlanc's contemporaries. And as we started to identify them, we found that many of them had either developed cancer or heart disease or had died from either of them. And so essentially what this means is they or their next of kin now have a clear path to making compensation claims.
Oh, really important. Katie Nicholson, thank you.